I had to wait on your kudos. Okay. Yeah, I believe that we do have to support some reform in healthcare. I believe that tort reform is one of the first things that we do have to do. Tort reform being that we need a cap on frivolous lawsuits so that doctors and medical workers and hospitals and things like that can have some relief from some irresponsible. It doesn't mean that all lawsuits are irresponsible, but I think that we'd all agree that we're in a legalistic society where there's a whole lot of people out there in circumstances that otherwise shouldn't be filing lawsuits, and they are. And so tort reform, also allowing health plans, health insurance companies to compete over state line. I believe that also, just those two things right there, if you allowed tort reform, or if you had tort reform and you brought an interstate plan where you allowed insurance companies, insurance plans to compete over state lines, you could draw down the cost of health insurance and health costs in this nation 20 to 25%. And I think that would go a long way in a lot of people's lives. Is it a right? No, unfortunately, I don't believe it's a right. But thank God that our doctors take oaths to care for people. I believe that we do have to have laws. If someone's taken to a hospital and they're dying, they need to be cared for. I haven't had health insurance by choice for about 10 years. And that's coming from a household that's had some pretty serious health problems. So I understand this issue. I understand it's an important one, but we do need to make some changes.
I also don't believe health care is a right, but I think there's another problem that's connected to that. I think the church and social services were so willing to get the burden of responsibility away from themselves that they handed off the responsibility of the church and gave it to the government. That's why we're in the mess that we're in right now. And if we could go back into time and have the church continue, all the hospitals, think of the hospitals that were built by Christian organizations because it was a Christian obligation. It's not the government is not only amoral, it's immoral. When we turn to government, we get amoral, immoral decisions. I want to talk about something else. We're in the UN. We shouldn't be in the UN. The UN has the United Nations has no authority over the liberties of the American people. They have no authority. We should not be in the United Nations. They have no authority. If the United Nations tries to tell me I can't spank my son, how did we get there in America, folks? And the second thing that I feel needs to be pointed out, we heard legalese up there. I heard Jeanette Mall say a version of what Bill Clinton said. It all depends on what the meaning of is. I read those 13 questions. I understood what they said. I didn't answer them as a lawyer. I answered them as a citizen. This is the way I read it. That's one way the best around. Words mean things. They're clear. Shall not means shall not. You need a lawyer to tell me that.
The healthcare mess that we're in today we're not in the healthcare mess because the government didn't do anything, and now we need to fix it. We being the government. No, that's the reason why our healthcare is a mess is because government's been meddling in healthcare for a long time, and as long as we have a system where you have the third party payer, and therefore you no longer have a rational consumer in healthcare. You do not have any free market forces in healthcare to keep the costs down, and what you have is consumer corruption in healthcare. It's kind of like when my grandfather was in the hospital. For some reason, his bill had a lot of birth controls on it birth control pills that were billed on it. This is my grandfather. I think that would have been outrageous for my grandmother too, but that was, who really cares what the bill says? I don't have to pay for it. So, and it's that rational consumer that we've taken out of the healthcare process that has caused the system to go corrupt and caused the rising cost. And so what did we do? Well, the Obama healthcare plan kept the bad stuff and took away the good stuff, and which is the best quality healthcare. And we threw that out the window with that bill, and it's just a matter of time where you're going to see the quality drop dramatically if we can't stop this bill.
One, I don't believe it is right. I believe there's things we could do. We can allow doctors and hospitals to advertise price. We can help with healthcare savings plan. I do support tort reform because that's one branch of government telling the other branch they are way out of line with the people. But you know, over the last 10 years, the federal government has been getting more and more involved in your healthcare. Yeah, I'm sure you can ask the doctor. He has run tests and jumped through hoops that the federal government requires of him, and that helps the cost go up. Over the last 10 years, there is a branch of healthcare that is, over the last 10 years, the prices have decreased greatly while their quality has gone up. And that's because there's no government interference, and that is LASIK surgery. No government interference, prices are going down, quality is going up. Now the government's been getting involved in our health care, and prices have gone up, and now the solution is for the federal government to take it over completely. To me, that just doesn't make sense. Another thing, you know, there's an old statement that says, "He who fails to learn from history is destined to repeat it." The Russian government got out of the UN for years, and the UN did everything, raising their tariffs, limiting oil into Russia, reducing energy, and they even jumped into the backyard of Russia, and Russia got back into the United Nations and was willing to pay a fee because they realized it was for their vital safety to have veto power.
Healthcare is absolutely not a right, but there are real solutions. Some of them are being able to buy insurance across state lines, the same as we do with our auto insurance and our homeowners insurance. Some of it is transparency and giving you, the consumer, the information that you need. Minnesota found that when they let patients know what the cost of procedures were and be able to call doctors and be informed on what the services cost, that not only did they decrease cost, but they increased quality because you gave consumers the same information that you have for every other good and service that you are consuming in the market. So if we give you that information, you're going to be making educated decisions. That's going to be a market-based solution. It's going to solve some of that. We can look at real tort reform solutions like we did here in Ohio, where we put up a gatekeeper function. We said you have to have a doctor say there's a factual basis to your medical malpractice suit to get in the door of the courthouse. That if you don't have a medically factual basis, you can't get there. So we've had states like Minnesota implement consumer-based decisions. States like Ohio implement things like tort reform that work, and we should be looking at those instead of the failed system from Teddy Kennedy's home state, which is what we just implemented on a national level. We should let small businesses like mine band together so that they can get lower rates. So there's some real market-based solutions that we could be looking at, which again are not government expansion. It's allowing you, the consumer, to make the decisions and drive down costs.